Experts have told a Water and Sanitation Summit in Johannesburg that there is an inconsistent availability of clean water in poorer communities. They say the inadequate upkeep of water infrastructure, which helps prevent the leaking of sewage into rivers and dams, has led to appalling sanitation conditions in informal settlements and densely populated areas. Tshwane is one of the regions that has seen poor water and sanitation affecting residents. There have been several cases of typhoid fever reported in the municipality, and Tshwane MMC for Health, Rina Marx, joins us now via Zoom. A very good morning to you, Ms. Marx. Thanks for making the time.
Thank you. Good morning.
Should the public be alarmed?
No, not at all. We've only got about 7 confirmed cases in Tshwane. And we've got over the country, we've got 64 cases in Western Cape, 18 in Northwest, 45 in Gauteng, 12 in Mpumalanga, 9 in KwaZulu-Natal, 7 in Eastern Cape, and 4 in the Free State, and 4 in Limpopo at the moment.
That's quite concerning, and the trend is going up instead of the other way around.
It's remember that we do get sporadic cases every year. This is endemic to South Africa, and it's spread via the Salmonella typhi bacteria to people because of dirty water or food. So it's very important that we remember that this is something that's been with us for many years. In 1993, we had about more than 1,000 cases reported to the NICD, and in 2005, Delmas in Mpumalanga had more than 400 cases reported. These cases, 3 of those patients died then. Then we had, over the rest of the time, every year we have confirmed cases coming forward. So it's no need, there's no cluster outbreak in Gauteng at the moment. So as soon as there's a cluster outbreak, then we do have a problem, and then we have a concern about it. But at the moment, there's no reason to feel alarmed by this. We've got everything under control, and the Department of Health are keeping a very close eye on this.
Let's just remind our viewers about what typhoid fever is and how it presents.
It's called enteric fever, or also called typhoid fever, and it's caused by dirty food or water, contaminated food or water. So it's very important for people to follow strict hand hygiene precautions, and also wash their food, vegetables and fruit before they use it. So when you use the bathroom, they have to wash their hands with soap and water. Gets spread from person to person also, especially when there's poor hygiene, and it's and the food, and they should not leave cooked food out for more than 2 hours.
Yeah. And have the affected people been received treatment? How can people treat themselves at home?
Yes, of course, they've been treated. The affected people receive treatment through health facilities in Tshwane and also in the rest of the country. These cases has been reported and registered with NICD. Remember, these are communicable disease that has to be reported. Symptoms normally includes high fever, headache, stomach pain or cramps, either constipation or diarrhea, and then also flu-like symptoms. If they experience anything like this, they have to go to their nearest health facility for investigation, diagnosis and treatment.
And also, just how we've spoken about treatment already. Let's speak about, you spoke about the numbers in the different provinces, but just
yes,
exactly what mechanisms or fighting strategies is the city of Tshwane putting in place to prevent further cases?
The water gets tested on a regular basis, and that is the start point for this. And patients are informed. They get education regarding symptoms and signs, and then they need to go to their nearest health facility. They also get health education on the importance of hand washing and safe food preparation. So this is extremely important, and that's the way that we keep the community informed and ask them to go and see somebody if they do experience any of these above symptoms.
Yeah. So what is government doing just in terms of a national strategy?
On a regular basis, and make sure that there's no reason for alarm. And also the public education, health education concerning these matters that they need to do and follow.
And you reckon that there's sufficient public education?
Yes, I think so. Because I've recently also visited some of the clinics, especially in Tshwane district. And the clinics are really, they've got more than enough educators in the clinics and also enough pamphlets. It's on the media, it's everywhere for them just to get. So they do get enough education on the importance of this.
Ms. Rina Marx, thank you so much for making the time to speak to us this morning.
You're welcome. Thank you so much.
Rina Marx is the MMC for Health in the city of Tshwane, just talking to us about that growing reports of typhoid across the country.